I know. You're doing so good. That was our big one.
Ryan Briggs is having a seizure. The crackling sound of the saliva being suctioned from Ryan's mouth, a daily reminder for his mom, Diana.
There were times where Ryan had been awake for 72 hours seizing, and we just prayed for sleep.
Both of Ryan's past and how far he's come.
We have now taken Ryan from over 400 seizures a day at his worst to now most days under 50.
Obviously, these aren't all the children.
Senator Mike Fulmer has a daily reminder, too.
There's Heather Schuker's child, there's Jackson Salami, Ryan right there.
A tapestry hanging in his Capitol office. Children benefiting from Pennsylvania's medical marijuana program.
Cannabis for Mike Fulmer wasn't about the buzz. It was about the patient.
3 years ago, Fulmer became close with Ryan and his family. He, as one of the state's top conservatives, joined Senator Dalen Leach, one of Harrisburg's most liberal Democrats, to pass SB 3. Now Act 16 of 2016, Pennsylvania is one of 33 states with a medical marijuana program. 21 conditions are covered, including autism, cancer, chronic pain, epilepsy, opioid addiction, and PTSD, helping to date more than 100,000 patients statewide.
We're not done in the research here as we're going forward. We know that it's a safe medication. We know that marijuana by accident could help people. I want to know why.
Which brings us here, Farrell, Pennsylvania. This once proud steel town, 80 miles south of Erie, is home to Pennsylvania's newest medical marijuana grower plant, Pharmaceutical RX. It's one of 13 fully operational grower-processor plants, 10 of which are shipping medical cannabis out to Pennsylvania's nearly 50 dispensaries.
This is an 83-year-old brick industrial building, and we kind of like to keep the character of it.
CEO Rebecca Myers gave FOX43 an exclusive look at the new facility back in February.
It's really exciting.
Department of Health rules against visiting are so strict we can't even show you what the inside looks like today. We can only tell you marijuana plants are growing. They will take 24 weeks to fully cultivate and process before it's shipped to dispensaries.
What separates Pharmaceutical RX from other growers in the state, possibly even the country, is what they're doing to study the compounds in marijuana. Highlighted by what is going to be taking place in this room. It doesn't look like much now, but pretty soon, thanks to a partnership with Penn State, they hope to transform the way marijuana is used as medicine.
With changing environmental factors, we might be able to increase the expression of those other molecules to get a sufficient amount to start asking questions about how they interact with our body and how they might be beneficial as well.
In other words, doctors at Pharmaceutical RX are hoping to find cures for diseases using cannabis.
We're just straightforward about it. We're looking to actually improve global health. It's a big statement.
These cells are dying, not just dying in a way.
Meanwhile, at Penn State Hershey Medical, Dr. Zhang Yun shows us what happens when marijuana is mixed with pancreatic cancer cells.
One of the compounds we have tested indicates that it can do so by killing those cancer cells, what you just saw.
Dr. Yoon, alongside Dr. Kent Vrana, are studying if cannabis can actually help illuminate cancer cells inside the body, making it easier for our immune cells to fight back. Today, their tests on colon and pancreatic cancer show marijuana is actually helping to eliminate cancerous cells.
And that's what we want to figure out. If they're effective, how are they effective?
I'm going to go get your food, okay? Let's have some lunch. Put that in. I hear ya.
Diana Briggs knows marijuana works for Ryan's epilepsy.
Nothing ever stopped them or lessened them. It was, he's having a seizure.
He'll likely never be seizure-free.
That little movement right there is a seizure.
And just a single 0.03 milliliter drop she gives to Ryan once a day allows Diana to think, what if? 3 years ago, Ryan Briggs was visiting a doctor every 30 to 60 days. Today, thanks to medical marijuana, Ryan sees a neurologist once a year.
I never imagined or dreamed that we would get the control of his seizures with just a plant.
Pennsylvania's medical marijuana industry brought in $132 million in sales in its first year. That's more than first-year sales in neighboring New York, New Jersey, and Maryland. Some patients tell Fox 43 those numbers could even be higher if medical cannabis in the state was more affordable. We address that and numerous other issues still facing Pennsylvania's medical marijuana industry Thursday as our Fox 43 Focal Point Cannabis in the Commonwealth series continues. Matt Maisel, Fox 43 News.
I'm sorry, but the government has no right to tell me what I can do with myself.
It's a Monday night at the new Bloomfield VFW in Perry County.
What's going to happen to these children? Are you going to take care of them?
Parents, young adults, war veterans all step up to the mic.
If they do it, or they're doing it right now while it's illegal, that's on you. You should be taking care of your children.
Welcome to the 24th stop in Lieutenant Governor John Fetterman's recreational marijuana listening tour. By June, Pennsylvania's newest LG plans to visit all 67 counties. Fetterman sits up front for 90 minutes, nearly emotionless, while one by one.
No, we don't want to legalize marijuana in Pennsylvania.
I do not believe it's a gateway drug. It's not an opioid.
Dozens share their thoughts. Should Pennsylvania become the next state to fully legalize marijuana?
It takes it out of the shadows, and it will eliminate the criminal aspect of it as well, too.
Fetterman wants to legalize, though he won't say this during his county visits. In fact, for the most part, he lets others do his bidding. Pittsburgh area State Rep Jake Wheatley has a recreational bill up in the House, while Philadelphia area Democratic Senators Dalen Leach and Sharif Street have their own in the Senate. And Auditor General Eugene DePasquale is perhaps pot's biggest proponent in PA. He estimates a taxable marijuana program would net the state $581 million a year. He gets that number from admitted smokers found in a federal study and comparing to how much is spent in states like Colorado and Washington. Governor Wolf hasn't taken an official stance, but did sign off on Fetterman's tour.
The governor, in his wisdom, believes that Pennsylvania is ready to have this conversation. States around us are having this conversation. We need to have that. And the only way, in our opinion, is to fully engage everybody.
You're talking about a Schedule I narcotic as defined by the federal government. To legalize it because it makes money is not the way to do public policy.
Senate Majority Leader Jake Corman says he doesn't know anyone in the Republican caucus wishing for weed, and therein lies the rub. Unlike medical, which had wide bipartisan support, recreational marijuana is about as split as it gets.
This is a whole different issue. I think a much more serious one.
Currently, 10 states and D.C. fully legalized marijuana, all following Colorado.
It turns out that the voters were way ahead of the Colorado legislature when it came to this issue.
Dan Pabon was the Denver area state rep who, in 2013, wrote Colorado's legalization bill after Colorado voters approved it first. This was 12 years after the Centennial state legalized medical marijuana. Pabon and many others were originally against it.
There were a number of us who were opposed to it, not necessarily because we didn't believe in the issue. I don't think we understood the issue.
Colorado voters approved recreational marijuana with a 55% majority. By comparison, in Pennsylvania, a Franklin and Marshall poll taken in March this year showed 59% of people here were in favor of legalization. Pabon says Pennsylvania is taking the right approach, going slow, collecting data. However, statistics coming in from Colorado show that in the 5 years since pot's been fully legal, there still may be plenty to learn. A study done by the Colorado Department of Public Safety shows total crime in the state is up 12% from 2012 to 2017, and violent crime is up 28%. What we don't know is if those stats have any connection to marijuana.
I don't see any reason for us to jump in while we don't know some of these answers.
I've personally called Senator Corman to invite him to these listening tours in his district, and I value his opinion deeply.
Which is what the lieutenant governor has said to Republican lawmakers in each tour stop. Few have taken him up on the offer, though. State Rep Paul Schemmel said on the eve of the visit to his home, Franklin County, that Fetterman was full of it.
I believe that the listening tour is a sham.
A lot of people are speaking tonight who have never, ever tried it, and that's okay. Everybody has the right to do what they want to do.
The tour, though, marches on.
Legalize it. Just do it.
On this night in Perry County, one of the most conservative counties in the state, about 2/3 of people attending were in favor of legalizing marijuana.
I've been smoking for, my God, I'm 66 years old. I'm not dead yet. I'm not gatewayed over. Ever put a needle in my arm?
One by one, up to the mic.
I think the federal government needs to butt out.
Voices of today, questioning tomorrow. While Pennsylvania lawmakers do not appear close on fully legalizing marijuana, and Pennsylvania cannot, unlike Colorado, put a marijuana initiative on the ballot, there may be a movement to decriminalize pot in PA. Last session, the House Judiciary Committee for the first time approved a bill to lessen the penalty for small amounts of marijuana possession. It was not brought for a full House vote, and no bills have been brought forward yet this session. Matt Maisel, Fox 43 News. Jessica Friedman walks away. She has to.
I liked it. I loved it. And it was me and that drug till the day we die.
She walks away from a dark past. The past that found her addicted to heroin at 14 years old. That landed her in jail at 23 for stealing from her mom. That saw her brother, a Marine Corps vet, commit suicide while addicted to the same painkillers she was hooked on too.
He ended up to 22 pills a day when he shot himself in the back seat of his car.
Today, Jessica Friedman is on a new drug, medical cannabis.
When I start thinking like, oh, I'm getting stressed out and those old things come back, I'll just use it, and all of a sudden those thoughts slow down again.
She says it saved her life, even though her brother couldn't get it in time to save his.
When you live in a society where thank you for your service and is every other word, and you're put on a hero's pedestal, how can you be a hero and have a mental illness at the same time?
Amber Andrusik says she wants to help. A veteran herself, Andrusik today is the Cumberland County Director of Veterans Affairs.
We're not saying that we think veterans should use medicinal marijuana, but we want to make sure that they're aware that it's available.
See, Andrusik says she can't flat out recommend it because marijuana is still a federally banned Schedule I drug. And even though PTSD is one of the 21 conditions covered in Pennsylvania, vets in need can't get it prescribed at a VA center. So Andrusik makes sure her fellow vets know it's there.
Although we respect that, in the state of Pennsylvania, it is legal. And when you look at the opioid crisis we're going through right now, and the substance use among veterans is through the roof.
Congress does have the power to change the classification of cannabis as a Schedule I drug, and there are currently bills in Congress designed to give the VA more freedom in prescribing it. Fox 43, though, reached out multiple times to the 6 active congressmen and senators in the Fox 43 viewing area to see if they would be in favor of a marijuana classification change in the FDA. Only 3 responded, and Congressman John Joyce and Scott Perry, as well as Senator Pat Toomey, are all not in favor.
In all honesty, you really want to know the facts here?
Lebanon County Republican Senator Mike Fulmer is still as passionate as ever when it comes to medical marijuana.
Here's a fact for you. You're not going to be hurting your liver on the long term. You're not going to be hurting your pancreas.
The stigma attached to medical cannabis, he felt, is strong enough to propose SB 475, which in essence would treat card-carrying medical marijuana users the same as anyone else using prescribed medicine.
Just as if they had a prescription for Oxycontin or Percocet. We don't skew them differently. I don't want medical cannabis patients to be skewed differently and to be held differently because of misconceptions and misinformation.
Which brings us back to Jessica Friedman.
Thank you for calling Omni PA. This is Jessica. How may I help you?
Now 7 months clean, she's the operation manager for Omni Patient Advocates in Camp Hill, which basically helps guide new medical cannabis patients through the registration process. And it can be expensive. Patients tell us just to get certified with a condition by a doctor, it's around $200, then another $50 for a card. Caregivers have to pay nearly $20 for a federal background check. And that doesn't even count the medicine itself, which varies by patient and could run from $100 to $300 a month, although prices are expected to come down as more growers and dispensaries hit the market statewide.
So everybody that comes to Omni, $5 of their fee goes to helping other veterans with PTSD.
Veterans like Jessica's brother, Corporal Dane Friedman, the namesake of the foundation she started.
It took me a long time to not cry working at Omni because I was just so happy about what I was finally helping people instead of hurting people. You gonna go for a walk?
Jessica Friedman still walks away, only now her future is much brighter. Of the 3 congressmen who responded to our FDA question request, we've published their full responses on our website, fox43.com, and we will continue to follow up with the 3 who did not respond. As for Senator Fulmer's bill, it has been sent to the State Senate Judiciary Committee, where it is still awaiting a vote. Matt Maisel, Fox 43 News.